All right,
Why
continue.
you why you only two?
That person is not
Who's the person?
here. Jennifer.
Jennifer. That big mama, eh? The one that was you guys.
No.
Eh? She's also big. Right.
Okay. Good morning, sir. Good morning, my colleagues. Okay, our patient here is an 18-year-old young man, and from the information we have here, it says that when this young man walks just 200 meters, he starts wheezing, and then he goes to the gym and just exercising exacerbates the wheezing. Say the wheezing worsens, and then he goes to his general practitioner and complains to him. And he was also talking in sentences to his um, general practitioner. But also made us to understand that when he is trying to converse with this man, I don't know whether the general practitioner is a man or a woman per se, but then on conversing, his respiratory rate increases. That also is an indication of asthma, in the sense that he wheezes, and also when he's talking, his respiratory rate increases. The normal respiratory rate is from 12 to 20 breaths per minute. So obviously he might be having more than that. And then he was now diagnosed of mild asthma, given that he has these two signs, of which you know that asthma, according to GINA, the Global Initiative of Asthma, is a condition of chronic inflammation characterized by wheezing, cough, chest tightness, shortness of breath, and also expiration limitations, of which he has two of them. So it's a fair play to say that he has mild asthma. And then he was given salbutamol and also um, beclomethasone, which is an inhaled corticosteroid. According to GINA and NIEP, National Asthma Education and Prevention Program, they say that once someone is diagnosed of asthma, be it mild, be it moderate, be it severe, you should always give an inhaled corticosteroid. This will help with the inflammation and also give him a relief, which is salbutamol. It's an immediate relief, and it's a SABA, short-acting agonist. So from this focus, I can say that I'll also the goal of my treatment is this. I'm going to try as much as possible to abate the symptoms that my patient has, and also to maintain his lung function. Remember, okay, I didn't mention that his peak flow rate was 420 liters per minute, which is actually 80%, which is very okay, meaning that his lung function is okay. So, giving him salbutamol and inhaled corticosteroid, I'm going to advise my patient also to make sure that he doesn't just take the salbutamol, because when he feels this urge, like he's wheezing and he wants to release himself, and he takes just the salbutamol, it's a quick relief. He might forget that he has to also take his inhaled corticosteroid. So I'm going to make sure that I emphasize on him taking both of them, because the other one is for immediate relief. Meanwhile, the inhaled corticosteroid is going to actually act on the inflammation. So him taking just the SABA will give him the relief, but it will also cause exacerbation over time, meaning that the inflammation is going to be increasing over time if he takes only the SABA. Meanwhile, when he combines both of them, he's going to be, tackling his inflammation as well as getting the immediate relief from his SABA. So our question was the risk factor as relates to this particular patient, of which my colleague is going to talk about.
Okay. Good morning once again. Picking up from where she stopped, I'll be talking on the risk factors. And generally, for an asthma patient, the risk factors might include allergens, occupational exposure, maybe family history also there as a risk factor. Someone that has a long history of asthma in the family, then the person stands a chance of being asthmatic also. Then allergens, these are substances that when they are inhaled, they trigger an allergic reaction. So somebody can also be exposed to asthma by these allergens. Other risk factors also includes maybe drug effects like NSAIDs. Those are also factors that can trigger asthmatic states in someone. Now to tackle the question as regards to this group, which says what are the risk factors to the patient in question. Now given the case we have here, we have been told that when he walks 200 meters, he begins to have wheezing. And also, he also goes to the gym. And when he goes to the gym, his wheezing worsens. So I will now say that the risk factor to this particular patient is exercise. His exercise causes his wheezing to increase. And again, also considering that since he's 18 years old, as we were told, and we know that one of the risk factors of asthma is age. Now, asthma is predominantly pediatric disease, but can also occur in other age. So this
Time up.
person,
Okay. 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 So he said that exercise is a risk factor for asthma. Do we agree with him? Yes. Huh?